Thank you, Kendra and Megan, for joining us today to talk about your northern placements. So we just have a few questions prepared that feel free to answer those, or you can just sort of talk as you feel about the process. So if you could just give us some background information on your placements, sort of the orientation process, just some background.
Sure. You start with orientation? Yeah, sure. Okay, start with orientation. We did a 2-day orientation in Winnipeg at the Health Canada FNIB head office, and it started off with like documentation protocol, kind of the community demographics, just getting to know the different communities, and of course the ones that we were with one other girl who was from BC. So it was very like a very intimate orientation at first. And then the second day, it was a lot of preparing us for like the community needs in terms of like communicable diseases, STIs, immunizations, wound care.
Immunization thing. And we were put with the nurses that were actually getting orientated to go up,
which is really cool.
So it was nice. So I met a nurse who ended up being my preceptor for the last week. So that was kind of cool.
I didn't even know that. Cool. Yeah. Sweet. Yeah, and then they so they provided all that kind of information, but then we also, because we got to kind of get to know them, they all had a special place for our communities, and they were all so welcoming and totally got us stoked to go, because obviously leading up we're just like, oh, what are we getting into?
Yeah.
So excited. Yeah.
For sure.
Yeah.
Okay. So can you tell me a little bit about the communities that you were placed in, what the accommodations were like?
Sure, go for it. So I was in Puckatawagan. It's an hour north of Flin Flon, so flying community until the winter road is open. So yeah, that was, the traveling there was a process.
For her more than me, for sure. It was a process regardless, but for you more so.
It's not like I wasn't expecting things to go wrong, and I think that's kind of why it went so, like, I was okay with everything, because I was like, oh, something's gonna go wrong, I'm gonna lose a bag, I'm gonna lose my food, like,
I'm gonna end up in a different community.
So I didn't know anyone, and they just like put me up in a hotel, and it was
hilarious.
Yeah, it was kind of crazy. I slept the whole time I was there, so it wasn't too big a deal. But
So you spent like an extra day
traveling. Yeah, we both left Saturday morning, and I didn't get there till Sunday afternoon. So, and it was just kind of like a fluke. Like they had a plane malfunction, and then there was no pilot to take me to my community. And but once I was there, I lived in a duplex, so I had one half of a house completely to myself, and it was honestly maybe like 2 or 3 years old. Like it was brand new, like leather couch, flat screen TV, double bed.
Oh yeah, we're going off the grid for sure.
Yeah, really hard living.
Yeah, it was tough. It was nice. It was good.
Okay.
I was at God's Lake Narrows. It's northeast Manitoba, kind of like almost right in between, if you look at the map, between Winnipeg and Churchill, kind of where it starts to go up there. It's a population of like I think around 3,000, and just so beautiful, so much water, so many islands, and just so beautiful, even though it was like really cold when I was there, but so nice. And the accommodations I was in is probably very similar. Mine was right across the street, the condos we were in, and I was in the older residence, and then there's also a newer residence. So it was a little bit different, but still totally cozy. I ended up being kind of roommates with one of the mental health therapists who has been there the longest. So the apartment was very like according to the culture of the community, because she was very close with a lot of the elders and whatnot. And it was super. It was just great.
Awesome.
I wasn't alone, but I think at times I was, because people would fly in and out. So
same for me. Like my housemate was there all the time. She worked in home care, but she went home every weekend. So sometimes I was alone.
Can you talk a little bit sort of about how long you were there, what kind of hours you worked?
I got there on the 14th of January or so, and we were there till the end of February. So Monday to Friday Friday is clinic, so it's 8 to 5. Everybody works it, and in mine we had about 5 nurses at any given time, a physician Monday to Friday, a dentist, and 2 mental health therapists, but the nurses are the only ones that were there the whole time. So everybody did clinic, and the cases were anything from primary care to like chronic disease management to emergency care, and then also some community as well. Even though they had other community resources, you end up doing it all, and you just take someone in with a chief complaint, and then it just goes from there. But then the remaining hours is divided up between all the nurses. So everyone's always doing on call. So you will work your 8-hour clinic day, but then you will also do a chunk of call every night, except you have like 1 night off a week. I don't know if yours was like that. But yeah, that's pretty much mine.
Yeah.
I don't know if it was very similar.
Yeah, mine was similar. Same thing, 8 to 5, 8:30 to 5 was clinic. Like Mondays and Wednesdays were chronic, Tuesdays were prenatals.
Yes, right.
Thursdays there was like an admin day, so you got like half the day off, and then...
And it was a continuing education, right? So that Thursday admin morning, you would also, there's usually some sort of telehealth thing.
Yeah.
Okay.
So whether it's like on MRSA or whatever.
Yeah, and then all that other time is like walk-ins, emergencies, whoever's coming in is coming in. And then same thing, so someone's always on call from 5 to 9, someone's on call 9 till 1 in the morning, and then someone's on call overnight 1 until 9 a.m. in the morning.
And then they work all day too.
Yeah.
It's so funny though, you hear that though, and like I personally would have been like, man, this is gonna ruin me.
Yeah.
And like that's the cool thing is you're able to, as a student, they completely, I kept saying like, oh, maybe I'll come in, and my preceptor's like, you just tell me when you're showing up. You're the nurse here, you just tell me. So if you wanted to work a few days off, a few days on, you could do that.
And so, out of the times that of call, would you get called quite often? Like, did you often go in for call things?
Typically, well, for us, from 5 to 9, you're covering whoever else is still sitting in the clinic as like a walk-in.
They see everybody, like they don't send anyone home.
And you're doing your phone triage. So whoever is the nurse in charge is doing phone triage throughout the day, and then from 4 till 5, they're taking phone triage, and they give you your patients, and you can make the call whether you want them to come in or you want them to wait till the next day, or kind of how you want to do that. So from 5 to 9, you're typically there. So those days you have a 12-hour day, and then from 9 until 1, it's more
hit and miss.
Yeah, it's more phone triage and just kind of like, you have a sore throat, I can see you tomorrow kind of a thing sometimes. You just have more flexibility, I think, to make that call because you're not already in the clinic.
Right.
And then from 1 until 9 in the morning, it's strictly like phone triage. And then if you want to see someone, you call them in and you send the medical driver to go out and get them, and you wait for them at the station. So,
But typically, like, there was this kind of a weird stretch where we didn't get any calls, but there was usually always something, just because they have so much responsibility and accountability up there that, like, we always would see children, no matter what. Obviously, the more experienced nurses they were really good, obviously, at triaging, so they knew, but a lot of them would tell us for the first few years working up there, they just saw everybody because there's so much on you, right?
Yeah.
Right.
But then there was always a second person. So you were on call, but there was always a number 2. So if there was someone else,
Actually, some big emergency that you gotta back up.
Yeah. So for us, if you had been on call the night before from 1 till 9 in the morning, and I was on call 5 to 9 that day, she is my first call. So like she's the first person I call, because typically if you've worked a night, you don't work at all on call the next day.
Yeah.
But if there's anything major that happens, everybody comes in. Like everybody runs in.
So how many nurses were there, sort of?
So typically 5, but 1 was the NIC, so 4 of us actually seeing patients and doing things like that. Same thing for me, a doctor Monday through Friday, a dentist 3 weeks in, 1 week out. Mental health, I think there's kind of 2 that switch back and forth and would come every other week. And
ours were very similar.
Yeah. And then there was home care too. There was a home care set up in my community, and I went with them for a day. day, and there was public health was run by the band, so they had their own public health nurses doing immunizations and things like that. So
yeah, it's cool. The band and the nursing station work together, as in the band kind of totally dictates the nursing station and who even actually gets hired there. They get a say, and they run the front of house and a lot of the community services like the tuberculosis management too, and yeah.
Yeah, okay. So what kind of patients would you typically see? What kind of like skills and knowledge would you use? You've kind of talked a little bit about what your typical day would look like. But
Well, I kind of was also recommending, like, I don't know if we're able to, but I kept track of everything on our evals too, right? Like all the skills we ended up using, and it was so diverse. Like you'd have anything from a newborn baby to an older adult, and anything under the sun. You might see one thing, and then you might not see it for another couple weeks, but you almost touched on
everything.
Yeah, from like community stuff to emergency stuff. A lot of mental health. But the cool thing is that anybody that comes in, you do a complete whole assessment on them, because it was a really good way to figure out what resources are needed for that person. And often whenever they were coming in for, there was something else going on, and so and then it's cool because you have the mental health therapist down this hall, even the dentist down the hall, and you just send them down.
Like a one-stop shop. It's pretty awesome.
Did you get a lot of practical skills too?
Oh yeah.
Totally. Sometimes there'd be a day or two like where you wouldn't, but like a ton of lab work, and also processing the labs to send them out, which is really unique. So you never get that in an urban setting. X-rays, which we didn't do. We helped. We never. Catheters, IVs.
Who would do the X-rays up there?
Nurses.
The nurses.
Well, actually, our maintenance man does.
Your maintenance guy did yours.
Okay. Interesting. Okay. And so lots of like, did you have like a lot of dressings and
tons of dressing changes? Tons of IVs, tons of dressing changes. There's only like a couple maybe NGs and catheters, because people would get sent out for kind of if they need to be admitted.
That's something I didn't see. I didn't have a person with an NG.
Okay.
But that was the only thing. Which everything else.
Yeah, honestly, like like a lot of things. It's just not. There wasn't like a lot of everything, but you're exposed to the advanced practice stuff. That like almost like an NP would do. We didn't perform. I don't know. You did. We did. I would be right with them, but we wouldn't get to do those like really invasive things. But
so suturing, prescribing, that kind of stuff.
And like vaginal exams, PAPs, all that kind of thing.
That was the best skill that I developed, and I'm sure you did too. Was the assessment skills and history taking, because someone would come in with a chief complaint, and the preceptors and instructors were awesome. They'd just hang out, and they'd be around if you needed them, but they just let you go, and you basically had to solve a puzzle. And they've got these amazing Health Canada guidelines that anybody can even access now, even if they're not going. And it's hard, because if you make the wrong assessment, then you could go down the wrong path. But they even have differential diagnoses, and then they tell you the type of management, what to prescribe, and when you need to seek like additional guidance.
Those are really, really handy.
So what would you say was the most significant in your learning at this placement?
I don't like that question. You go first.
Your head to toes, like you do a full head to toe
of
on
every
single person,
boy, girl, male,
and you
female.
just like everything, like, because then when you go to consult a doc, well, what's in their urine? Did you do a strep test? Did you do this? Did you do that?
So like, kind of your S-barring too. To be.
You just cover all your bases, so you have the answer for those questions, and I feel really confident with my assessment skills after you got there.
And it's cool because everybody's totally on their own. I loved being like, you didn't have to manage 8 patients at once. It's very different than what we'd get our final practicum here. It was 1 patient at a time, which is really cool because you didn't have to rush, but you also had a team if you needed them. And if something major did happen, like there were some days where it was nuts. And they're like, all right, we got Megan as an extra nurse. And I'm like, okay, cool. But yeah, oh gosh, so okay, head to toe. I definitely agree with that. I think the biggest thing for me was I knew I was really interested in doing something like this. Obviously, I couldn't predict what it was going to be like, but I honestly feel like everything that we learned about in nursing, like every theory course and every practicum, like we saw that in up there. Like it was just like everything you had to really, and even learning how to not judge, because they have a completely different foundation up there, different belief system, different traumas, different strengths, everything. So you'd constantly have to check yourself and then reflect and just
Yeah. Awesome. So what would be some of the challenges that you faced?
That might have been one of them.
That's a good thing. Challenge and strength.
Yeah.
It was different being in the minority for once.
Yes. Yeah.
Like you go to the one and only store, the Northern.
Oh man.
And people know who you are and they know your name and like you've never seen them before, and it's
they know you, that you've arrived in the community.
Yeah, and they know. Yeah. And like you want to like make a good impression, but you like have to stay true to your job and like what you're doing, but making relationships.
Yes. Like big time. You had to be like I'd call someone in and they'd be, just come in like any other client, and my preceptor in the beginning, she'd be in the room and you'd see them light up when they'd see her, and I'm like, okay, I get it, like I'm not there yet, like gonna need some time. But they said that took them like a while to get there. Which like understandable.
One of the things too, like I didn't ever really experience it, but I think we were both kind of worried about being alone. And like not really having supports, but I didn't find that.
Polar opposite. I've never felt more supported.
Wow, awesome.
And like supported and challenged. Like I ended up having a lot of different preceptors, so that was could have seemed like a challenge, but I ended up getting to be with a lot of cool people. I was supposed to have 2, I ended up having 6 preceptors. And they all would like drill me with questions, and I was like never, but like I was in an environment that I was not afraid to be wrong, like and with some of the codes, like incredible nurse like experience, because they just, you were the student at the nursing station, everybody took care of you.
Wow, awesome.
Yeah,
for sure. So some suggestions for the future. So if you were to do it over again, is there anything that you would do differently?
I sure wouldn't pack 30 pounds worth of books.
I wouldn't pack meat because I'd have to throw it all out when I got food poisoning. No, definitely not the books.
No, not the books.
So tell me about the packing and the food.
So, I'll just go with
It really depends who you are, though.
Like I took clothes that were comfortable. I took jeans and sweatpants.
I wore jeans once.
Scrubs. But just comfy stuff. I took my ukulele. I took painting stuff, like things to kind of keep me busy.
But I actually honestly didn't even end up using it. Like I had a very social experience.
Okay.
But it's still good to bring that stuff. There was an exercise thing, facility area in one of the residences, which was huge. There was a treadmill at mine. Yeah, it was a little scary. Was yours scary? Yeah, mine was scary. It was very scary, but I ran on it. But I ended up doing like yoga and fitness classes, like DVDs with the other nurses, and that doesn't really answer the question.
No, what was the question?
Is there anything
packing-wise
differently? Didn't pack that you wish you would have taken?
Yeah, just less. You don't need anything. Just comfortable clothes.
Comfortable clothes. Get Mosby's the little pocket manual for the head to toe assessments. One of the nurses up there had that, and I was like, oh my god, this is amazing. This is all I would have needed.
Yeah, I saw that too. And because you have your guidelines up there. And what I loved, because I think I ended up doing a little more shadowing than you in the beginning, and it drove me nuts, it was good though, because I was super nervous at the beginning, but then it made me like really hungry to get in there, which was good. But I brought a notebook and I just wrote everything down as it went, and I think that was helpful. And then it's a good tool for when you do your reflections too.
For sure. So what advice would you have for someone else coming into this experience?
be comfortable with being uncomfortable.
Okay.
That's a good one.
Like all around, going
And
in.
just
throughout.
honestly, yeah, expect the worst. You're gonna have an awesome time, but expect the worst because something's going to happen. Like
Yeah.
my travel, that was like really the only thing that happened. But you know, getting food
It was
poisoning.
such a fun experience. I couldn't have bonded with my preceptors more.
That sounds like super negative, but just like don't have crazy expectations, and you're not gonna be disappointed.
Like we knew we had to check in a lot and have a lot of moments of reassuring ourselves in Winnipeg because we knew it was going to be like a life-changing experience, but we were just like, also like, it's going to be good, right? It's going to be like, you know, like, but it, like when we saw you guys before we left, we were just kind of like let go trying to figure everything out, and don't try to figure everything out.
Yeah.
Like don't, like, my mom made me bring a satellite phone. I didn't touch it once, but I mean, I brought it, you know? And I think also the type of people that are, like, I think anybody, if your mind's open enough to, you can do it, but I found it very helpful to, like, I like being isolated and kind of adventuring out, but you also have to be willing to be sociable, because you could easily just hang out in your room, and they say people do that and they don't have a good experience.
Yeah.
So kind of a,
Be open. Just be open to every opportunity you can get, whether that's in the station, out of the station.
Get out of
with
the
your priest.
station.
Yes. Oh my God.
that was
get
fun.
out. Go
Yeah.
do things.
Yeah. Yeah, like, I don't know what you did, but I judged a science fair, which was really cool, because you can really see how some people, like, where people start to drop out of school, so you can see where you need to, like, empower people. And they had a radio station. I presented on the radio station on crystal meth, because their band counselor came to us and said, we need someone to present on this, because it's becoming an issue and we want to tackle this now, which was so cool, and that was by far one of my favorite experiences.
Kind of still with like the healthcare team, but I went and did home visits.
Right,
and that was so eye-opening.
You get a whole picture.
Oh my God, do you ever? And it's heartbreaking. And then at the same time, it's like
This is awesome.
Yeah. And it's just like people don't know any different. That's just how they've lived their entire lives, and that's how it's gonna stay if something doesn't change. And
Yeah, but there's also a lot of positives in that. Like, it was so cool how there'd be 15 people in a house, but they were so close. And even if someone was having trouble in the community, it wouldn't be like, and everybody's fed up with this person, but somebody would always take them in. Like, so there was it's so easy to be like, okay, like, we need to do something. And there were times where, like, I would get really, really mad seeing how there's a lot of inequities, but then there was a lot of positives too, a lot of strengths.
totally.
So.
Sadly, we had a few deaths in our community throughout the time that I was there. I think there was 4 in the last like 3 weeks that I was there, and it was weird. Like, some of them are related to each other, and it was really hard. You could see that it was hard for the families, and the last day that I was working, there was a funeral, and not a single person came to the station, because every single person that lived in that community went to that funeral.
Yeah. Oh yeah. If there's someone's getting married, everyone knows it's a quiet night.
Yeah.
And having said that, we had someone pass away, and everybody came to the station till, like, I think time of death was called around 8, and everybody was there till 4 in the morning. Like, it was really cool.
Yeah,
So
same kind of thing for us. The whole family was there. The band came there. They smudged to get rid of the negative energy, and that made my heart so happy. Like, I cried because of that.
The smudging.
Yeah, and just how everybody came together, and the culture and everything mixed in, and it was beautiful.
Yeah.
No, it was like, I've had so many people ask me. I was telling Kendra this. I was seeing my friends this weekend in Canmore, and they all really want to hear about it because they're really interested, and they were just stoked that I went. And I'm like, I have a hard time telling you, and I don't think I can, because I can't, like, communicate it. And my preceptors warned me. My one preceptor, Adam, and he was like, you won't be able to explain it. And I actually ended up telling them some stories, and I was shaking. It was weird. It was just like, it was crazy, like, for like nursing and personal development. It was just a very good experience.
Yeah, it was really nice when we finally got together, when we were
It was like, you get it.
Yes! Like, we didn't have to go into like crazy detail and stuff.
We just had to nod and stare at each other. But yeah. Oh, and just fun little addition, we rescued a cat at my station because he was freezing outside the nursing station. Our maintenance man, x-ray guy, brought it in, and my instructor was like, well, can you have a cat? And I'm like, well, no, but like, yeah. So, like, not allowed to have a cat at all, but let's get him. And even his little ear froze off. We named him Bernie, and ended up, I was like, well, we'll keep him for now, and we'll figure it out. New mom, this guy.
His name follows me everywhere. I've renamed him. His name is Tulio.
Yeah.
And he is the best cuddler and my son.
And he's so from the north. Like, he knows.
Yeah.
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 So you brought home a souvenir.
Yeah.
It's like the best gift ever.
I get to take care of him tomorrow.
That's great. So would you have any suggestions for the college in supporting future students going to this placement? Anything different?
Honestly, I think this is a great step, having resources for people. Just like you said before, like we were just like, it's gonna be okay. It's gonna be okay, right?
It's gonna be okay.
So this is great. I think this is a really good resource. And other than that, though, like it was good. Like I talked to April on the phone up there.
Our team behind us back here was awesome.
Yeah.
Good.
Yeah, she was very supportive and very relaxed, but yet there when we needed her, and just really good balance.
For sure.
I think, like, at the beginning there was a lot of unknown, and in a weird way I think that played an important part. It just got you used to not knowing what you're getting into. So you just know that you're okay with that. But yeah, this video, and like I was also going to say, if like people want any of our papers that we wrote, or like
I have pictures.
We have lots of pictures,
of like the residents and like the whole nursing station.
Or if anybody just like wants to go out for coffee, but that might get really busy. We could go talk about it.
For sure. Well, great. Thanks to both of you. Do you have anything else you'd like to add?
It's the best thing you'll ever do.
Yeah, we're going back there. We're gonna go work.
Yeah, absolutely.
Awesome. Well, thank you to you both.
Thank you.